Hi, my name is Gordon Lee. I'm a professor of plastic surgery at the University of California in Irvine. I just recently relocated down here after having been a professor at Stanford for the last 18 years. So getting down here was getting closer to my family. And I was shadowing the chairman of dermatology in his clinic to get some additional clinical exposure, thinking that maybe I might be a dermatologist someday. And there was a Mohs surgeon who was doing skin cancer excisions, and I got to work with him because he asked me if I could help him. And so that was my first exposure to surgery. I'd never seen anybody cut on somebody before. And there was an occasion where the cancer was so big, they decided to call a plastic surgeon down. And that plastic surgeon was William Lineweaver, who is the editor-in-chief of the Annals of Plastic Surgery Journal. So he was my first mentor in plastic surgery. He invited me to come to the OR, and then he invited me to come and do research with him. Plastic surgery always seemed to call upon me. I just enjoyed doing that type of surgery. I enjoyed the patients. I enjoyed the faculty, the residents. It fit in well with my personality. And I guess the rest is history after that. I like microsurgery specifically because it's a technique, not so much a body part. And it allows me to work in different parts of the body. Some days I'll be working on the scalp and the head and neck. Another part of the day, I'm working down by your foot and ankle, doing some complex reconstruction for trauma, or I'm working in the trunk or the breast region for breast cancer reconstruction. So it really is a broad field. I really like that. I like seeing my results. It's kind of something, I'm a very visual person. So when I do something and I see what's happening, for example, like a free flap for breast reconstruction, I've got this piece of tissue that's come from the abdominal area, and we cut the blood vessels off, and this thing's, for all intents and purposes, ischemic, and then you cut the blood vessels again, it comes back to life. And watching that blood vessel pump and the tissue become alive again, it's hard to describe. And I think, microsurgeons share in that excitement when you reperfuse tissue. It's just something about it. And so I will mention specific mentors that I've had who really influenced me. I mentioned Bill Lineweaver, who was my first plastic surgeon I'd ever met in my life, and who then inspired me to pursue a career in plastic surgery, and such a great role model, just a kind gentleman who was really interested in education. And I was just a medical student at the time. And Kenneth Hoy, his colleague and partner at Stanford, who also took me under his wing, and we were doing research together on rabbits. And then in residency, it was the faculty at UCLA who really inspired me. William Shaw, Henry Kawamoto, Tim Miller, Andrew DeLeo, George Rudkin. They were also instrumental to me. Prosper Benheim, Neil Ford Jones. And I'm probably leaving out a few other people. But and then in fellowship, Howard Langstein, Jeff Robb, Ron Yu. There's so many more mentors who were just really good, positive role models. Jim Chang, who was my boss at Stanford, really encouraged me to be involved in the CSPS. I started off as the program director liaison. So as the residency program director for Stanford, I helped liaison with all the program directors in California through the California Society, and we would meet every year. Through that, I became involved in the committees, specifically the scientific program committee. So participating on abstract reviews and helping develop the scientific program. And really, it's just about showing up, to be honest with you. There's a lot of free jobs that we do in plastic surgery to help plastic surgeons to be involved. And I've always valued that. So from the program committee, I got involved in other committees. And eventually, I was lucky enough to be recognized as someone who, after nearly 18 years of service in the California Society, would be someone who could further contribute to the society at leadership level. So I worked my way up from, member at large, parliamentarian, secretary and treasurer to president-elect and now president. And it really is an honor. Well, of course, I always tell medical students, keep an open mind, depending on what level of medical student you may be, medical student year number 1, 2, 3, or 4. When you're first starting off medicine, I think everything's exciting. OBGYN, plastic surgery, trauma, psychiatry, everything's interesting. So be open. And then if you're interested as a medical student, get involved, do some shadowing experiences with plastic surgeons, come to the national meeting or the state society meeting where you get to meet other residents and students and faculty in plastic surgery. Maybe do some research projects if you're really, really interested. But I encourage young people to say every year, to step back and say, am I happy? So if whether you're a medical student, a resident, or a faculty member, or a private practitioner, are you happy in what you're doing? And there are some days that are good, and there are some days that are maybe not so good. But I always say, you really have to reassess yourself. And if you're doing something that you're really not happy with, is that healthy? Is that the way you want to spend every year doing something that you're not happy with? Or is it time to make a change?